Well, people living in a small town in Saskatchewan say they are getting used to their hospital's emergency room being shut. Doctor shortage in Watrous is leading to on and off ER closures, leaving a community of more than 1,800 people without reliable emergency health care. For more on what's behind the disruptions, we're joined by Angela Sisler. She's the executive director of the Interlake Human Resources Corporation. Angela's organization supports a group home in Watrous for people who have intellectual disabilities. Thanks for taking time to be with us today.
Good morning. Thank you for having me.
So you have shared that your local hospital's ER has been closed between 30 to 40 times this year alone. When did this problem start?
We definitely saw a lot of closures last year already, but the majority have been in this new year since January.
A lot of individuals in your community's group home, they live with serious medical issues. So what's the plan for them, and what happens if you go to the emergency room and it's closed?
Yes, so we work with adults with intellectual disabilities, and some of our residents have some complex health issues. At this point, I don't even think we would bother trying the Watrous emergency department, even though our group home is literally across the road. We would have to drive about an hour away to access emergency services and health care.
We know that it is staffing shortages that are the major reason behind these closures, lack of doctors and nurses available to keep them running. Can you describe for us how these disruptions affect you and your clients personally?
Well, just to be proactive with doctor's appointments and ongoing care, we're having to look at accessing care in other communities, driving away for appointments, and then, of course, staff have to take our individuals, so then that leaves us short-staffed at the home. How do you cover the services that you're already providing? And then, of course, worrying if there's an emergency situation. Somebody with a disability is already going to struggle with understanding, potentially, what is happening to them, let alone having to go and wait hours, days at some times to have emergency services.
You know, you've described this not having a reliable emergency department and the negative effects that it will have on the community of Watrous. What are you most concerned about?
Well, obviously, I'm most concerned about the safety of the residents in our town. My parents are in their 70s. If something happened, are they going to make it in time, let's say, if there's an emergency? Our clients that we support, and then just in general, there's a ripple effect. If we don't have emergency services or doctors, as a young family, are you going to choose to move to a community that in general is fairly thriving, as opposed to choosing a community that has a doctor and emergency services, whether you have a young family with kids or you're looking to retire? You're not going to retire somewhere where there's no doctor and no emergency care as your health needs get more serious as you get older. So I think it's a ripple effect for our community, and it makes us less appealing, and you worry down the road. Small towns are struggling.
Well, you've outlined so cleanly the conversations that are happening all over this country. You've got people who are moving out of bigger centers because housing isn't affordable, but do they move to a smaller community, which is a great place probably to raise a young family. But if you are dealing with lack of emergency services, not reliable health care, you're right. Where do you go? We did reach out to the Saskatchewan government for their take on this. Here's what they had to say in part. The Saskatchewan Health Authority has implemented several strategies geared towards stabilizing and enhancing access to ER services for residents in rural and remote communities. Those include the virtual physician program, point of care testing, and health care human source initiatives. Since launching in April, the virtual physician program avoided 18 disruptions in Watrous. But it does not talk about emergency room care. What's your response?
I find that interesting because I know nothing about how to access virtual care. Luckily, I don't need a lot of health care myself. But what does that look like? How do I access it? And maybe it did divert 18 instances, but we're looking at 30 to 40 closures as it is. Our long-term care is not even at capacity because there are not enough CCAs to work. So you can't have one staff to 28 residents. interesting comment. I don't know how you access those things, and I don't know that that's been made available to the general public on how to do so.
And also, if you've got clients with complex care needs, not having a regular or primary physician adds further complications. Angela, what do you want to see the province of Saskatchewan do?
Well, I wish I had all the answers. I don't. I would like the province of Saskatchewan, the government of Saskatchewan, to specifically address what the plans are all the way through the system. I think it needs a complete overhaul, obviously. I've been told from healthcare workers here in town that, for instance, there's very few full-time positions, lots of part-time positions. Well, people can't make a living on part-time, and so they're choosing other jobs or leaving healthcare in order to make ends meet at a different position. So potentially offering better positions to everyone within the healthcare system, and considering that the needs of all the staff have to be looked after. I really commend all of the staff we have here. They're trying their very best, but you're burning them out. And we're going to lose even more. And again, it's a vicious cycle.
You know, Angela, I feel like there's people all across this country watching their screens, nodding their heads in relation to what you've laid out for us today. Thanks so much for joining us.
Thanks for having me.
If you like that video, make sure to subscribe to the Your Morning YouTube feed, where you can find all kinds of new content posted every weekday morning.